Hello everyone, and thanks for watching this lecture from CyberMD. Today we will be discussing the four different heart sounds known as S1, S2, S3, and S4. Understanding the physiologic mechanisms behind these heart sounds is easily testable information on the USMLE STEP 1 exam. First, let's start with S1. S1 is also known as the lub sound. It's the first heart sound, and it's caused by the closure of the mitral and tricuspid valves at the beginning of ventricular contraction. It is best heard at the apex of the heart, which is the bottom tip of the heart, just to the left of the sternum. This is because the apex of the heart is closer to the chest wall, making it easier to hear the sound. Next, we have S2. S2 is known as the dub sound. It is the second heart sound and is caused by the closure of the aortic and pulmonic valves at the end of ventricular contraction. These valves are located at the base of the heart, and they separate the ventricles from the aorta and the pulmonary artery. The S2 sound is heard at the base of the heart, just to the left of the sternum. Together, S1 and S2 create the classic lub-dub heart sound, which I will play a recording of now courtesy of teachingheartauscultation.com. You will not hear any S3 or S4 gallop in this recording. Third, we have S3. S3, also known as the ventricular gallop sound, is an abnormal heart sound that is caused by the rapid filling of the ventricles during diastole. Diastole is the period of the cardiac cycle when the ventricles relax and fill with blood. In normal heart function, the ventricles fill with blood in a smooth and steady manner, but in certain conditions, such as heart failure, the ventricles may fill too quickly, producing the S3 sound. It is best heard at the apex of the heart, just to the left of the sternum. Placing the patient in the left lateral decubitus position may aid in the auscultation of this heart sound. It is often associated with conditions that cause increased filling pressures, such as mitral regurgitation and aortic regurgitation, heart failure, and thyrotoxicosis. Additionally, we've been discussing this as a typically abnormal heart sound, but it may be normal in athletes, pregnant patients, children, or young adults. Finally, we have S4. S4, also known as the atrial gallop sound, is an abnormal heart sound that is caused by the turbulent flow of blood that enters a stiffened left ventricle. In patients with a pathologic S4, there are often high atrial pressures and ventricular noncompliance. With that being said, it also can be normal physical exam finding in older adults. It is best heard at the apex of the heart. In summary, S1 and S2 are the normal heart sounds that are caused by the closure of mitral and tricuspid valves for S1 and the closure of the aortic and pulmonic valves for S2. S3 and S4 are typically thought of as abnormal heart sounds that are caused by various pathologies, but sometimes may be normal, meaning there's no pathology at all. S3 and S4 occur during diastole. These sounds can be heard by a trained healthcare provider using a stethoscope and can provide valuable information about the health of the heart. Again, the presence of S3 or S4 sounds can indicate the presence of certain cardiac conditions, such as heart failure, that may require further medical attention. Thanks for watching this episode, and make sure to subscribe to our content.